Well, really happy to be talking to you today about this topic. I've actually been working on this topic for 20 years, almost 20 years, which is a little discouraging given how important it is. But it's a complicated topic. It's not an easy one. So hopefully I'm going to help you wrap your heads and hearts around it a little bit. It's very personal to me, as it should be to all of you. These little guys here, this is MRSA, MRSA. Maybe you've heard about that one in the news. Some of these others too are E. coli and Salmonella. Even in the best of circumstances, some of these bugs, some of these staph and E. coli and Salmonella bugs can cause disease. And the problem is, and why I'm here today, is that more and more strains of these bacteria are getting more dangerous. And they're more dangerous because they're more resistant to the antibiotics that you need to treat them with if your life's at risk, or your child's life's at risk, or your parents' life's at risk. So how many of us have had a course of antibiotics in the last year or say? Yep, me too. Not by choice. I tried to avoid it, as everyone should. But in this case, it was really indicated. And more importantly, a lot of us have family members. My dad just turned 95, and he's in a facility where they're exposed to more infections. His immune system's depressed, like a lot of elderly people are, like a lot of kids are. And so these vulnerable groups are going to be more at risk from getting these infections from resistant superbugs. So just to kind of recap, because these are long talks, but I'm going to try to break it up into pieces. And think of it, if you're like me, you probably do too much binge watching of Netflix, right? And you have a new series, and they have all sorts of tricky ways of talking about episodes of a new Netflix series. So think of this talk like a Netflix series. And maybe episode 1 is something like The Crisis. Episode 2 is something like How Did We Get Here? Episode 3 is kind of the climax in the series. It's where everybody's really despairing, and I've depressed the heck out of you, because it can be a very discouraging topic. But then we start moving towards hope. And so the fourth episode maybe is where we talk about we already know what we need to do. That's the good news. We've known for a long time what we need to do. We just haven't done it. So the hope is that if all of us in this room, if all of us watching at home could really pay attention to the things that I'm going to tell you that we can all do together, we can really make headway against this problem, and quickly. So antibiotics, I'm not quite 60. They predate me. Alexander Fleming, of course, made some of the key discoveries, first of all with penicillin, and it was an accidental discovery, and that was in the mid-1920s. But it didn't get commercialized. He got the Nobel Prize in 1945, and he gave a lecture to the Nobel Committee, and he talked a lot about how it was really a happy, fortunate accident, a mixture of circumstances that let penicillin get developed and in widespread production. And a big factor was World War II. Suddenly they had millions of people who had injuries, traumatic injuries, that many of them would have died if there wasn't this new miracle drug called penicillin. And so the fact that it was a war effort meant that basically companies were dictated to that they would be producing this and quickly and getting it into the public domain. I was going back through some articles and I saw this picture from the Mayo Clinic proceedings of a young girl, 4 years old, previously healthy, right around the same time, a few years before actually, Fleming got the Nobel Prize. So it's 1943. This would have been a not uncommon circumstance. This young girl's at home. She's got an infection on her skin, and it gets dramatically worse. Her fever spikes to 104. The infection starts spreading. Her neck and airways are swelling, and she's in danger of basically suffocating because this is impinging on the airway. And before penicillin, she very well might have died, would have died. She starts gasping for breath. Now, luckily, there's this new miracle drug, penicillin. They give it to her. After 2 weeks, she goes home. I mean, this is, by any definition, kind of a miraculous thing. And yet, we take it for granted, don't we? We can't conceive of a world where we don't have these miracle drugs at our disposal. And yet, that's the world we're entering, where things like penicillin for this girl are no longer going to be available to us. That's why this is urgent. That's why I'm here talking to you. That's why all of us need to be asking what more we can do. So how did we get here? Well, it wasn't just penicillin that came about with World War II. Very quickly, there was a whole slew, a whole pipeline of drugs that got developed. And think of these like the low-hanging fruit. Penicillin was discovered from a mold strain, after which it was named. And in fact, in nature, molds and other organisms create penicillins. And so a lot of these early drugs, in fact, many of the drugs that we still have today were discovered because people sifted through all sorts of microbes. They created petri dishes, and they found that there were these antibiotics there for us to take advantage of, basically. So there was a lot of investment, a lot of discovery, trying to figure out how quickly we could get these into use on the battlefield, in the hospital, in the clinics. And so for a long time, for decades in fact, there was a period where we were adding more antibiotics than we were losing. We had a whole pipeline of drugs, and in fact, people started to say things like, gee, these are nifty drugs. What else can we do with them? And so very early on, you're going to hear Maren McKenna later. If you're not here later in the week, I would highly recommend that you hear her talk or look for it online on the chicken industry and how the chicken industry formed out of the routine use of antibiotics. Same with the pork industry. In fact, very early on, the Mayo Clinic cooperated with Hormel, the maker of Spam, to figure out how to use more antibiotics in pork production. Very unknown story, but in a recent book, I found it fascinating. People didn't think twice about this. They said, hey, here are these miracle drugs, let's use more of them. And that's what we did. The problem with that, though, is that, as you're going to hear later in the talk, using antibiotics is the quickest way to make resistance to them form. The more we use them, the more resistance. And the quicker the resistance comes on. And at first, there was a very low level of resistance to these drugs, and so it took a while for kind of our overuse of them to catch up to us. Well, it's caught up, and then how? So that now, if there is, by some miracle, a new drug being developed, resistance to it comes about very quickly, much more quickly than the first widespread resistance developed. We can talk a little bit more about why that is later. But so that the main points here is that use drives resistance. We've been using a lot of antibiotics for a very long time. And now we're at a point where we're not creating any new antibiotics, or virtually none. The low-hanging fruit were picked a long time ago. Now we're just trying to hang on to the tetracyclines, the erythromycins, the sulfa drugs, the extended spectrum penicillins, the Cipros. We're trying to hang on to those and keep those effective for as long as possible. But we're in a race against time because quickly their effectiveness is waning. Their effectiveness is waning, and we're not creating new drugs. And I may get into this a little bit later, but basically I don't think we can't reassure ourselves that some miraculous scientific discovery is going to happen and we're going to create a whole new pipeline of drugs to bail us out. Probably not going to happen. We may get lucky, but it's kind of like, you know, seeing the weather change and hoping that some huge machine's going to take all that carbon out of the atmosphere for us. It's probably not going to happen. Oh, let me back up a second. So there is this term that's being thrown out there called the post-antibiotic era. It's kind of wonky. What it means is a time when we can't depend on antibiotics. And this is going to change not only all of our lives, but all of medicine. So a post-antibiotic era is where we're heading to. Maybe we're already there. Some people certainly think so. But we're at least heading there very quickly. Why worry about this? Well, there's a lot of different answers to that question. One is that people are dying already. It's going to get worse, but people right now are dying in large numbers from these superbug infections. And when I say superbug, what I mean is infections caused by these bacteria that are resistant to antibiotics. So you don't get immune to antibiotics. That's kind of a misconception. The antibiotics don't get resistant. What gets resistant are the bacteria. They develop this machinery that makes them not killed or not combated by antibiotics. So you can throw an antibiotic at a resistant infection, it just won't work. And so the person who has that infection keeps getting sicker. And they may die. They might recover on their own, but they may die or be maimed. So right now, unfortunately, we don't track antibiotic use very well, and we certainly don't track antibiotic infections very well. You would think that there was some sort of a central effort to really track how many people are getting sick and dying of these things, right? You'd think so. Not true. In fact, all we have is good guesstimates. And the latest guesstimate from the CDC is that every year we have about 2 million cases of antibiotic-resistant infections, and of those, 23,000 people die from them. Now, the CDC is the first to admit these are lowball numbers. These are they use the word conservative. These are very conservative estimates. In fact, one resistant superbug alone, MRSA, the one that a lot of us have heard of, at least 19,000 deaths a year. Well, here's the kind of bad news, is that recently there was a study out of Cambridge Press by some researchers at Washington University, St. Louis. So a very good medical center, and a team there said, hey, you know, the CDC 6 years ago came up with this lowball estimate that we have 23,000 deaths a year. We're going to look at those estimates and come up with our own model. So they did, and they wrote a letter, and it got published. Their estimate is maybe more than 150,000 dead a year. Why haven't we heard about this? Why? This is far more than people are dying of AIDS, for example. Far more. Why haven't we heard about it? Well, because these are largely invisible victims. These are people in hospitals. We're not in hospitals. We don't go to hospitals. Even if you went to a hospital and you picked up their chart, you know what it would say? It would say organ failure. It wouldn't say antibiotic-resistant infection. Even though that's what's causing the organ failure, if they die and they get a death certificate, guess what? No mention of antibiotic-resistant infections. We don't require that to be on the death certificate. And so when researchers go back and try to figure out, like, why did all these people die? You know, why is there a spike in people in nursing homes dying? Turns out some of them have these really resistant superbug infections. That's why they're dying. It's invisible, or at least it used to be invisible. It was the old, the sick, the infirm, the immunocompromised that got these. That's changing. Now we have people like Carlos Don, 12 years old, died of MRSA. Rebecca Lawson, 17, died of MRSA. These are young people. These are athletes. They're healthy students who one day start feeling crappy, and a few days later, maybe a week, they're dead. Very scary stuff. If you read between the lines or you read closely around sports, MRSA is something that you find fairly frequently in locker rooms. So a lot of sports teams have had problems over the years. You know, maybe the environment wasn't as sanitary as it could have been, but mostly it's just, you know, a lot of sweaty people rubbing up against each other, tackling each other, in a wrestling room having contact. Good way to spread a resistant bug. And some of them are getting very sick. Brandon Noble survived, but his NFL career was over. And this is not the only occurrence of this. You got to kind of search for it, but those stories are out there. Death is terrible. I think we can all agree on that. But a lot of these people, even when they survive, they're hugely impacted. Their lives will never be the same. This single dad got a resistant E. coli infection, lost about 8 inches of his colon, you know, spent weeks in the hospital. He survived. Who was taking care of his kids? You know, what did that do to them, thinking that their only parent, that their single parent might not survive? So these are the kind of impacts, costs that don't get added up. So it's not just me or Maren McKenna talking about a post-antibiotic era. It's the head of the World Health Organization, Margaret Chan. So a few years ago, she said, a post-antibiotic era means medicine as we know it isn't the same anymore. It's changed. What does she mean by that? Well, how many of us have had one of these things? How many of us have had, or at home, have had a spouse or yourself have a C-section? I think statistically, maybe 1 in 4, 1 in 3 women who give birth have a C-section. Well, could we do C-sections if we couldn't be assured that there would be an antibiotic to treat any infection that might come about? Could we do transplants? Could we do chemotherapy for cancer patients? All of these things are often, not always, but often complicated by infection. As a doc, I'll tell you that if you think the risk is too high, you just won't do a procedure. You won't recommend it. It would be bad medicine to say, hey, I'm going to put you through this procedure. Even though there's a very high risk, you're going to get an infection that I can't treat. Well, or just don't do the procedure. Don't get a knee replacement. Don't get chemotherapy. Don't get a transplant. That's what a post-antibiotic era looks like. It's an era where these things are no longer possible because it's too dangerous to do them, because we no longer have drugs that will work if your surgery gets complicated by an infection. So in that post-antibiotic era, a lot of these things are off the table. Now, could you be in a car accident, have some sort of traumatic injury? You're in the ER, you're in the OR, and and it's very likely in that sort of trauma situation that you're going to get an infection. Very likely. So they're going to treat you. They're going to do the best they can because they don't really have a choice. There's no choice involved if you're in a horrible accident or if you're in battle. So in that situation, we're going to continue to do what physicians and others have always tried to do. They're going to do their best, but it's going to be less effective. Why worry indeed? Well, there was a pre-antibiotic era, right? Before Alexander Fleming. We didn't have these drugs. My grandfather was a doctor. I never met him. I asked my dad, like, what was medical practice like in the 1930s? And he said quite honestly, they really couldn't do much, you know, and I'm sure that's not true, but parts of it are true. I think by that he meant that there were no antibiotics, right? Their phrase, if a kid came in with a walking pneumonia, you know what they would say? Tincture of time. Okay? That's what they would say to the parents. And what that means is, let's just wait and see. Maybe they recover, maybe they don't. Community pneumonia, 1 out of 3 deaths. 1 out of 3 people with a walking pneumonia died. For something like a cardiomyelitis, you know, somebody with an infection in the heart, or meningitis, an infection of the brain, more like 80 to 100% of people died. Skin infections, you know, little impetigo or some kind of staph or strep infection in the skin, 1 in 10 died. Today, those seems like nuisances, right? You get a little skin infection, you go to the clinic, they give you something, it's gone. Back then, people worried, and with good reason. So in a post-antibiotic era, you know, we probably wouldn't be back to the pre-antibiotic death rate, but we're going to be somewhere in the middle. We're going to have more problems. So I promise, this is discouraging, but I'm going to tell you, I've got to, just like Netflix, I got to get you really kind of worried and engaged before I give you the good news, before we hit the other side. So bear with me. Why worry? Because this isn't just our problem. This isn't just a problem on Long Island or in New York or in the United States. This is a global problem. Why? Because these bacteria travel. They travel in the plane, they travel in the air, they travel in the water. They travel. So if you get resistant infections in India, eventually they're going to make their way here. There's no way to prevent it. If you get resistant infections in China, same thing. So it's all of our problem. And globally, I told you that the estimate of the deaths in the US now are about 23,000, maybe higher, maybe as many as 150,000 a year. Well, the UK government commissioned a report, and a few years ago, one of the things that report did was to try to come up with a global estimate. And they looked out a ways. They said, what's the world going to look like in 2050? So, you know, that's getting closer than it used to be, right? We're already 21, that's 2 decades away. They said we could have 10 million global deaths a year by 2050 from superbugs. And the cost to all of us collectively could be $100 trillion. Now, people said, like, oh, that's an exaggeration. They're trying to scare people. Well, damn right they're trying to scare people. Because even if it's not 10 million, what if it's only 5 million? A lot of deaths. What if it's only $50 trillion? It's still going to affect you and I and everybody. So we're not doing enough now. Should we be doing more? Absolutely. This is why. So the costs are not just hospital costs. That's a big piece. But you get an infection that lays you out or lays your spouse out for weeks, months, maybe permanently with a disability. What's that going to do to your income? It's time off of work. But then there are all those costs. There's costs from these resistant superbug infections. They put you in the hospital more than your run-of-the-mill infections. You're sicker. You need more treatment. It takes longer to get better. There actually are more infections. It's not just that the same number of infections happen, but they're more serious. You actually get more infections when there are resistant bacteria around us. And you know, they're here on your cushions. They're in the airplane. You know, I flew in yesterday one of the places on the airplanes with the most bacteria is on the trays, on the meal trays. More than in the bathroom, believe it or not. That's what they found. So bacteria are everywhere. We're not going to get rid of bacteria. They're a part of this world. All we can do is to try to keep their levels of resistance down. So, all these costs together, both the direct treatment costs and all these indirect costs, the CDC thinks that maybe that's costing us $20 to $55 billion a year. You know? So what else could we be doing with that $55 billion a year? How much infrastructure could we build? You know, how many schools could we support? Tons. The world estimate, of course, is a lot higher. Oh, let me back up a second. So this looks like the first picture, right? We kind of think that this is our world. I mean, we don't really say it, but we kind of think it is. It's not. It's the bacteria's world. We live in their world. They were here before us. They're going to be here long after we're gone. It's their world. There's a lot more of them. In your gut, just in your gut, trillions of bacteria. Can multiply that by however many people there are on the planet, however many animals there are on the planet, gazillions of bacteria. Many of those are resistant. So they're everywhere. Again, there's no way to avoid them, but the main thing I want to say is, you know, maybe Madonna would have sang this. She would have said, we're living in a bacterial world, right? I won't sing it for you, but maybe she wishes she said that. I don't know. But we are living in a bacterial world. Let's think about the gut. We need bacteria. We can't digest. We can't be healthy without bacteria. And this is a hot topic now, the microbiome. Who's heard about the microbiome? Super hot topic, right? In medicine. We're still figuring out what that is and how it impacts us. But one thing we know is that there are people with a healthy microbiome, people with a good mix of bacteria in their gut, and then there's people with not such a good mix. And a lot of factors go into that, mainly your environment. So in fact, this study found that what actually creates your gut flora, your gut bacteria, is not your parents, it's not your genetics, it's the environment. It's what you eat, where you live, what you've been exposed to, if you change your diet, how many antibiotics you've taken. These things can all impact on your bacteria, and they can turn a healthy microbiome, a healthy set of gut bacteria, into an unhealthy set of gut bacteria. We're in a bacterial world. I'm not a bacterial girl, though. You know, that's how the lyrics go, right? So if we're in a bacterial world, and the thing that really drives bacteria to become resistant to antibiotics is using antibiotics, then you know, we have our problems in hospitals and in clinics for sure. I'm not largely going to talk about that, although I'm happy to answer any questions about it. What I want to focus on is the other side of the coin. That we've created a way of growing food, specifically producing meat and dairy, that relies on antibiotics. Not just a little antibiotics, but a ton of antibiotics. It's kind of integral to the American model for growing meat. That's not necessarily true elsewhere. And it's not all kinds of meat production. I mean, there's organic meat production. By definition, if you want to be a certified organic producer, guess what? You're not allowed to use antibiotics. Now, if say you're an organic producer and one of your cows gets sick, one of your pigs gets sick, do you just let it die? No, you don't. What you do is you treat it, but then you have to ship it off to a different setting. You can't sell it as organic. It's kind of interesting. There's actually different definitions of organic in different places. In Europe, you can treat a sick organic animal and still sell it as organic. So that's actually, from my perspective, a good thing, because we don't want farmers to not treat sick animals. We just want them to treat only when necessary, just like us, right? We don't want to treat people unnecessarily with antibiotics either. So anyway, this modern American model of farming animals, one that uses a lot of antibiotics, that started just about the time penicillin was first produced, only a few years later, and it's been ramping up ever since. So we have a choice here about how we want to grow animals, how we want to raise meat. Other countries have made a different choice, and I'm going to talk about that later, but we could make a different choice too. Why do we use antibiotics in these American factory farms? That's what a lot of people call them, factory farms. Why do we use so many antibiotics? Well, yes, we treat sick animals. And as I said, that's a desirable thing. Turns out that's just a teeny fraction. The FDA, the way it collects data on antibiotic use, for one thing, it doesn't really do a good job. There's absolutely no collection on the farm. So I can't go to a particular farm and ask them, well, I can't go on most farms. But if I could and I were to ask them, there's no government agency asking them how many antibiotics they use and why they're using antibiotics. It's definitely a good idea. Other countries do that for all the reasons you can imagine, because we want to know where antibiotics are being used. We don't do that. So in the absence of that, we can only guess. But the best guess I have for you is that only a small portion of the antibiotics used in the country are being used to treat sick animals. How do I know that? Well, 95% of the human drugs used on farms, so those are called medically important antibiotics, 95% of them are in formulations that are added to animal feed. So it's not like, hey, my cow's sick, I'm going to give it an injection and it's going to get better, right? That would be the ideal. No, we're just putting enormous amounts of antibiotics into animal feed for a lot of different reasons, usually not because they're sick. And in fact, mostly those herds of animals aren't sick. In the past, a lot of the antibiotics were being fed to animals to make them grow quicker. Growth promotion is what it was called. It was legal up until 2 years ago. It was legal to put penicillins and tetracyclines, millions of pounds every year, into animal feed to make animals grow faster. It was identified as a problem by FDA itself in 1977. They said this probably, we can't guarantee this is safe. In 1977, FDA put out a rule. They said, hey, we think this should stop. Penicillins and tetracyclines shouldn't be put into animal feed. And Congress slapped their wrists and said, don't do that. Don't stop that. And so FDA ever since has never taken an antibiotic out of animal feed that it had already approved until, well, no, it had never taken an antibiotic out of animal feed. What it did 2 years ago is that it said to the industry, we want you to stop selling antibiotics for use in animal feed to promote growth. And then after the companies all agreed to that, finally, after decades, then FDA changed the labels so that that could no longer be done legally. But FDA has never gone to industry and said, we won't let you do that anymore. They'll say, please, please, please don't do that anymore. And this time, fortunately, the companies agreed. Why else do we put antibiotics into animal feed? Why else do we put them on farms? Controlling disease, what's that? Well, that's when you've got a herd, and keep in mind some of these hog barns might be 5,000 animals, maybe more. and some of those animals are sick. And you want to treat the whole herd to control the disease from spreading within that herd. That's called disease control. So you have a diagnosis, you're a vet, you have a diagnosis that some of the animals are sick, you don't want it to go through the entire herd and maybe kill much of the herd. So you control it. Now hopefully, just like in human medicine, this is a one-time deal, and you give the antibiotic for a period of time and then you stop. So that's a possibility, and that can be through putting antibiotics in feed, but I don't really think that's mostly why antibiotics are used on farms either. I think some of the use is disease control, but I think almost all the use now is for what's called disease prevention. Well, that sounds great, right? Everybody wants to prevent something bad. Let's prevent disease. But in fact, what this is a lot of the same products that were used for growth promotion on their labels said to be used for growth promotion or disease prevention. So FDA said, hey, we're not going to use them for growth promotion anymore. But they can still be used for disease prevention. Same product, same dosage, same length of time. Both of them are animal feed products, but now we're going to call it disease prevention. And this is what we've really been worried about. This is what we've really been worried about the last several years, because everybody in Congress has said, we don't want to legislate, we want to wait for FDA to take action. And all FDA ever said is we're going to get rid of the growth promotion, but we're going to leave disease prevention in place. Again, often the same products, given in the same way, at the same or equivalent dosages. And that's where we are right now. So, what are the impacts of that? Well, one of the impacts is meat. All those animals have bacteria in their gut, okay? You give them antibiotics, you're helping to create resistant bacteria in the gut of that cow or that pig or that chicken. Well, eventually that animal goes to slaughter. And, do you think that the slaughterhouse is a pristine facility where there's no manure, there's no guts, there's no entrails? Of course not. Everything that was in that animal, including the guts and the bacteria and the manure, is all over the slaughterhouse floor. So we know that people working in those slaughterhouses are getting colonized, infected with resistant bacteria in greater numbers than you or I. We know that the meat coming out of those slaughterhouses, raw meat, mind you, it's not like cooked at the slaughterhouse, right? Raw meat carries antibiotic-resistant bacteria on it. So this is the last good numbers I could find from 2014, and this is a federal program that looks at meat samples and looks to see what percentage of the meat samples it collects are resistant to multiple antibiotics. So numbers are high in a lot of cases, right? You can see that. So I tried to highlight the ones in red. So here you have almost 40% of the beef that had salmonella on it. Those salmonella were resistant to 3 or more drugs. 36% of the turkey that had salmonella on it, that salmonella was resistant to 3 or more drugs, and so on, and so on, and so on. So, for a lot of these meats, there was a pretty good chance if you went to the grocery store that you'd be getting a drug-resistant bacteria on that raw meat. Well, the food safety folks say, oh, yeah, this has been a problem for a long time. All you got to do is cook the meat well, because, then it's not an issue, right? Wrong. Yes, it's good to have cooked meat for these reasons. You're not going to ingest cooked meat and get antibiotic-resistant bacteria in your gut, but what else are you going to do? Well, you're going to have the meat on the countertop, and then you're going to have the knife, and then your kid's going to come up and slap their hand on the countertop. So there are other ways to spread resistant bacteria from raw meat to people in your household, to you, if you're the one doing the food preparation. And what about upstream? What about all that manure on the farm or at the slaughterhouse? Basically, resistant bacteria is everywhere that animal has created manure, everywhere that manure is gone. So it's an environmental problem. It's not just a meat problem. It's not just a food safety problem. So what we've done basically, whether we're talking about antibiotic use in people or use of the same drugs in animals, is that we've created these environmental reservoirs, that's what they call them, reservoirs of resistance. So in those reservoirs are residues of drugs, yes, but also resistant bacteria. And the genes that make those bacteria resistant, the genes that make those bacteria resistant. And those reservoirs include our food supply. They include livestock farms. They include wastewater treatment plants. They include the streams downstream of a manure lagoon, downstream of a wastewater treatment plant. And the communities downwind, because I didn't know this until I started researching it, but resistant bacteria collect on dust particles. So when the wind blows off of one of these hog farms, and you're a mile, 2 miles downwind, you're exposed to resistant bacteria. So, there have been people, fortunately, who've been kind of sounding the alarm about this problem. I did tell you it wasn't a simple problem. It's not a straightforward problem. It's really complex. But even in 1998, Stuart Levy was a physician at Tufts University, microbiologist, still is. He's kind of retired now, but for decades, he was the most prominent person saying, this is a big problem. You should be paying more attention to this. And what I thought he said in this article from Scientific American, this is pretty readable, so even if you're not a scientist, I really recommend it. Now it's going on 20 years old. And it said, the whole world is like one big organism. And we're all little bits and pieces in that organism, especially the bacteria. And the genes are passed around throughout that entire world. So it's not just the bacteria that can hop in the plane or hop in the dirty water or hop in the meat, it's the genes. And this is where it gets a little more complex yet, because the genes don't always just stay within the bacteria, they get swapped between the bacteria. You're swapping your genes with me. I'm swapping my genes with my dog or my cat. The farm animals swapping their genes with the hospital. There's free flow of these things all over the place. Really tough to track, but the scientists who've really been focused on this can show you how this resistance travels from one reservoir to the next and back again. So we've got instances where drug-resistant MRSA traveled from hospitals to hog farms in the Netherlands and then back to the hospital inside of a farmer from that farm. So in fact, if you go to a hospital now in the Netherlands, because this has been such a big problem there, and they find out that you live in a farm or work on a farm, they'll automatically put you in isolation for MRSA until they can show otherwise that you're not carrying it. Like there's that much back and forth. So let's get down to basics. This is a fun little cartoon. I don't remember what these things are called, but my kids played with them. But this signifies you or me, and the red things are bacteria. And again, we've got trillions and trillions of bacteria in our guts, right? All of us do. And inevitably, some of them, maybe you've been on antibiotics for a recurrent sinus infection. Well, you stay on antibiotics long enough, you're going to get some bacteria resistant to those drugs. And that's the one with the little lightning bolt. That's the resistant bacteria. How did it get resistant? Well, actually, a variety of ways. Maybe it's something you got from your environment. Okay, maybe you ate it. But it could also have mutated. So the resistance could be something that just popped up through mutation. And how or why does that happen? Like you or I don't mutate, right? True, but we live, 80-year lives. A bacteria, its life is like that. So the generational time, they're reproducing very quickly. There's a lot more opportunities for mutation in bacteria. Then you multiply all those opportunities by the fact that there's gazillions of bacteria, and it's not surprising that mutations pop up. So that's one way. You can get it from your environment. You can get the resistance from a mutation. They can get it from other bacteria. So what happens is if you or I, the person in the picture, is exposed to antibiotics, maybe it's in our food supply, maybe it's because we're taking them, we're creating a pressure that selects for that resistant bacteria. What do I mean by that? What I mean is that we put antibiotics in our gut, and all the susceptible bacteria, the non-resistant bacteria, are going to die out. What's that leave? That leaves that little resistant bacteria. What's he going to do? He's going to do what bacteria do. He's going to multiply. So pretty soon, instead of having this really diverse gut flora of healthy bacteria and maybe a resistant one here or there, you've got a gut flora that's filled with resistant bacteria, or at least more filled. Guess what? Same thing happens in pigs. I mean, you've probably heard, right, that pigs physiologically are very close to people. We're both mammals. We're both big mammals. We even use parts from pigs in heart surgery, porcine valves, right? That's how much alike humans they are. And like us, they've got trillions of bacteria in their gut. Like us, they're getting antibiotics. Now, as I said, some of them are getting a lot more antibiotics than we would get, and they're getting them basically throughout their entire lives. And so this process happens much more quickly. Now, there's about 370 million Americans, but there's about 100 million more pigs. And every one of those pigs is like a little incubation container for resistant bacteria to form. And of course, those bacteria don't just stay in the pig, do they? They get pooped out. So everywhere that hog manure goes, we've got not only resistant bacteria, but we've got antibiotics. 75% of the antibiotics that go in a pig's feed end up in their manure. If the manure goes somewhere, say it gets spilled into a stream nearby, say it turns into dust, those dust particles, that waterway, they're carrying resistant bacteria and antibiotic residue sometimes. So basically all the makings for a little antibiotic resistance factory. Well, what happens next? I didn't lead with this because I was hoping you'd see where I was going, but anybody know who this guy is? This is Darwin, right? What did Darwin say? He said populations will change if you put a stressor that selects for the fittest population. Well, here we got a population of bacteria. What's our stressor? Our stressor is antibiotics. So we're selecting for the most resistant antibiotic. So if we have antibiotics in our system, which we do, lots of them, and we've got resistant bacteria, resistance genes in our system, we do, we're driving resistance. And that's what's happening on all our pig farms. That's what's happening in our hospitals. That's what's happening in our communities. I said 100 million pigs, but we actually have 9 billion chickens. That's just the annual, that's just the annual harvest rate. So that's a lot of little animal factories which, if they're getting antibiotics routinely, are helping to breed and spread resistant bacteria. So, Netflix episode number 4 or something like that. We're going to talk about these factories. What's actually happening at a micro level in these factories? What do I mean by resistance genes? There's a couple things I want to explain. Resistance genes don't exist in isolation, right? So we have chromosomes, right? We have 26 chromosomes. Each of those chromosomes has a lot of genes. They're connected on pieces of DNA. That's what a chromosome is. So it's pieces of DNA all in a row. Same thing in a bacteria. They have pieces of DNA, and a lot of times they don't just have that penicillin resistance gene there. They've got lots of genes, and a lot of those genes are connected, and they're all helping that bacteria create something that makes them resistant to different antibiotics. Okay? So say that piece of DNA is on a loop. You might have resistance to cephalosporins like fluoroquinolones like ciprofloxacin, but you also might have resistance to tetracycline, and it's on the same long piece of DNA. They're connected. Now, by the way, we don't only have resistance to antibiotics. We also have resistance to metals. We also have resistance to other ingredients in cleaning products. And part of our environment is to be exposed to all these other things. Why is that important? Well, it's important for this very crucial reason, cross-resistance. I'm getting kind of in the weeds here with microbiology, but basically what it means is that you don't have to be exposed to penicillin to select for bacteria that are resistant to penicillin. You can be exposed to cephalosporin. And because the resistance to those two drugs is linked, because it's on the same piece of DNA, being exposed to one helps make sure that you're selecting for bacteria resistant to all the other things on that piece of DNA. Think of this from the bug standpoint. So you're just kind of living your life. You're a bacteria. You're not resistant at all. Any bacteria is going to, any antibiotic's going to harm you, okay? Well, suddenly, your pal, who's a superbug, you meet up with him for the first time in years, he transfers all his resistance genes to you. This happens all the time. Bacteria are very promiscuous with their genes, including their resistance genes. So suddenly, all these genes that made your buddy resistant, now they make you resistant too. So in a flash, just in an instant, as soon as me, I used to not be resistant, now I'm resistant to 8, 10, 12 different drugs. And it's happened just like that. That's what's happening in all these reservoirs of antibiotic resistance. And it can happen very quickly. Now you factor in the fact that these resistant bacteria are multiplying so quickly, and you can understand how you can go from a single resistant bacteria to 1 billion in the span of 24 hours. And now we've been overusing these antibiotics for how long? Since 1950, basically. So that there's been a lot of time for this. It seems like it's, hey, all of a sudden we've got problems with resistance. No, this has been brewing a long time. So, different reservoirs. I mentioned wastewater treatment plants. This is like a little super factory for drug resistance to form and spread. The problem isn't that we shouldn't be treating our waste, okay? We should, of course. The problem is that what's going in there besides just our poop is the antibiotics we flush down the toilet. and the residues of all the antibiotics that we have taken. So, you know, sick people are still going to be creating feces, right? There's no getting around that. But if we stop, the estimates are that about 50% of human antibiotics are overused, are unnecessary uses in hospitals and clinics. Probably even more in clinics than in hospitals. But, you know, as much as half overall. That's a lot. And a lot of them are ending up here. So if we address the overuse, then we address the problem. As I said, we got a hog farm here. We've packed those hogs in. They're swapping bacteria. We throw into the mix daily antibiotics. Not such a good recipe. Well, it's a really good recipe if what you want is resistant superbugs, but not such a good recipe for us. But what's this? This is a hog farm with several barns that's been overwhelmed by Hurricane Florence, which was what, September? And this isn't the first time this has happened. This also happened with Hurricane Floyd in 1999. Why does it keep happening? Because the eastern half of North Carolina is very flat and it's surrounded by rivers, and that's exactly where all of these farms have been placed. To a great degree because it's a pretty poor area and there's a lot of historically minority communities there, and that's where the companies are placing these farms. And so when the flooding happens, all the people in those communities are getting exposed to resistant bacteria. All the people downstream, and then it's saturating the soils. This right here is a cattle feed lot, same thing. Huge amounts of manure created. It's got to go somewhere. So what do we do with manure from an animal farm? We put it back on fields. So all those resistant bacteria go back on fields. What do we do with the sludge? That's when they drain the water out of these wastewater treatment facilities, what do we do with the sewage sludge? We put it back on fields. They've renamed it biosolids and sell it as a fertilizer. But whatever treatment they do here, we know that it doesn't kill, it doesn't destroy antibiotics. And it doesn't even destroy all of the antibiotic-resistant bacteria. So we've created these models where we're spreading the resistance. All right, so hitting into the home stretch here. We're at like episode 4 on Netflix. The crisis is hit. We've got to reach resolution, okay? Or try at least. So what can we do? Well, I suppose if you wanted to focus on superbugs on meat, you could just zap the meat. You could irradiate the meat if you wanted. It doesn't really get rid of the problem, though, because you still have antibiotics in all these other places. So we're not going to do that, I hope. You could just treat the manure and do like state-of-the-art treatment like they do in Europe. They have much better treatment of manure, like human manure, animal manure, than we do. We could do that, and that would certainly help. But again, if you're still feeding the antibiotics in at this end and at this end, it's going to come out that end, right? So that's kind of not a great solution either. So here's, like, if you're going to take one thing away from this talk, this is what you ought to take. That's what we need to do. Maybe not take them away completely, but we should be reducing antibiotics wherever and whenever we can. We don't want to do that for sick people, but that half of use in clinics that's unnecessary, you got to figure out how to stop that stuff. And probably even more, like 60, 70% on farms, completely unnecessary. We know how to stop that. We just haven't done it. But if we do that, we take away the selection pressure. What does Darwin say? You take away the selection pressure, there's no longer a reason for bacteria to become resistant. There's no longer a reason for them to stay resistant. So you actually have some hope for restoring some of that healthy gut flora, restoring that healthy microbiota by taking the antibiotics away, and hopefully having a healthier food supply too. So again, this is not news. In 1976, again, Stuart Levy, this microbiologist, wrote in the New England Journal of Medicine, we know what to do. This increase in antibiotic resistance, it's coming from using antibiotics. So let's reduce our use. And we got to reduce it everywhere. 2013, what did the CDC? 2013, what did the CDC say? They said much of the use in animals, unnecessary, inappropriate, and it's making all this less safe. And, you know, I hope I've laid out a case where you can agree with that, because I certainly do. Well, how big of a problem is the animal side as opposed to the human side? They're both a problem. We're overusing antibiotics in both places. But just from a numbers standpoint, if we're talking about human antibiotics, these are penicillins, tetracyclines, sulfa drugs, cephalosporins, macrolides like erythromycin. Those are what I'd call human drugs. And if you look at all of those sold in the US, for whatever reason, 64% are being sold for use on farms. 64%. We have to not only focus on kind of the big picture problem, we should zero in on which kind of animals seem to be getting antibiotics most intensively. And this is from a report that I put out in November. So it's pretty recent number crunching, but I think it's really interesting. It shows that the chicken industry has actually been making great strides to reduce their antibiotic use. Right? And before, we thought it was a good thing, but we didn't really have a good indication of the impact of it. This is an indication. We have an enormous chicken industry, 9 billion chickens a year for slaughter, but they're using antibiotics measured by intensity. I mean the milligrams of antibiotics used per kilogram of chicken produced at just a tiny fraction of the rate that they're used in turkey production or pork production or beef production. So, you know, I'm not going to stand in front of people and saying, you know, you shouldn't eat any meat. What I'm saying is, even if you do eat meat, you've got a choice. If you eat chicken, if you're really concerned about antibiotics, if you choose chicken, chances are the upstream production of that chicken uses a lot less antibiotics than the upstream production of the same amount of beef or pork or turkey. And turkey's the worst by this measure. So happy Thanksgiving. Now, of course, the turkey industry, though, is teeny. My home state, Minnesota, biggest turkey producer. The number of major turkey producers is like practically on two hands. It's a small industry. So even though they use antibiotics very, very intensively, it's a teeny industry. What are the big industries that also use a lot of antibiotics? Beef and pork. So one of the things we can do is find ways to try to convince the beef and pork industries to move in the direction that the chicken industry has already gone. No routine antibiotics, minimize antibiotic use wherever possible, invest in alternatives to antibiotics to keep your animals healthy. We know how to do this. It's already been done. We just have to do it. Oh, I'm going to skip through that. It's not only farms that need to do a better job. We got to hold our leadership accountable. And frankly, they've done a not very good job. Well, I could say it a lot more strongly, but they've done a pretty crappy job. Given that we've known that the key from a policy standpoint is to reduce antibiotic use, This is what's not been done by Congress over the last, since 1977, 42 years. They have never passed legislation that tackles this problem head on. Instead, Congress has kicked the can to the FDA and said, let the FDA take care of it. Even though Congress back in '77 said to the FDA, don't you dare reduce antibiotic use in animal feed or we'll cut your budget. So now they've been telling FDA, you take care of it. And FDA did finally, in 2015, 2016, passed a guidance, a recommendation to the pharmaceutical industry to stop selling drugs for animals for growth promotion. I told you about that, right? They asked industry, pretty please, won't you please stop selling your products so that you can make less money off of them? And you know, after a couple of years, the industry did it. And then after the fact, the FDA said, okay, industry's taken them all out of their product list, so now we can make it illegal. So they did that. January 2017. So here we are, just 2 years later. I'll tell you later that some European countries started this process in the mid-1990s. Okay, 20 years ago. We're just getting started. But what has the FDA not done? Well, I'm sorry, let me back up. What have they done? So they've got rid of growth promotion by hook or by crook. And for the first time ever, they said you can't go down to Menards or Fleet Farm or Walmart and buy these antibiotics for animal feed by the bag. You used to be able to buy them over the internet. I could buy a 20, 50-pound bag down at the feed store. Anybody could. So for the first time in 2017, January, they said, no, you can't do that anymore. For these human drugs, you need a veterinary prescription. So for the first time, vets are actually involved. So that's a good thing. It's not enough, though. It's not enough. Oh, why isn't that working? There we go. And where are the gaps? The gaps are what I talked about before. They got rid of growth promotion, but you can still use the same drugs, often at the same dose, in animal feed, delivered in the same way, oftentimes without any time limit. So it's not like a 10-day course like in humans. Many of these animals can get as long as they have a vet saying it's okay, they can still get these antibiotics in their feed for weeks, months even. I hope they don't. We don't know for sure, but they could. What else don't they do? The FDA, the US government, has failed to ever set a target for reducing antibiotic use. And this is really in high contrast to countries like Denmark, the Netherlands, the United Kingdom, where practically everybody who's been involved in those countries has said, gee, the most important thing we did was to set a target and say, we want to reduce antibiotic use in animal production by 50% in the next 6 years, or whatever it is. In the US, the FDA and the USDA have said, we are not interested in setting targets. And I would say, you know, speaking as a parent, if you don't set a target, you're never going to get there, right? We also don't track, as I said earlier, where antibiotics are used. So there's nobody out there going to farms and asking them to say how much antibiotics they used and for what purpose. So it's kind of out of sight, out of mind. And that's a big reason why we're, you know, decades later still talking about this. Now, in contrast to the FDA, the World Health Organization is doing something. A year ago, they said flat out, stop using antibiotics to prevent disease in healthy animals. Boom. The UN is a member of the World Health, or the United States is a member of the World Health Organization, right? They were not happy about this. In fact, the chief science advisor to the USDA said that this was not based in science. And keep in mind, this is the World Health Organization, right? So I think they know the health science at least as well as the USDA. We can do better. Now, this is kind of a complicated graph, but let me tell you what it says. Remember that intensity of antibiotic use? That's a measure where we talk about it not in terms of pounds or kilograms, but rather the amount of antibiotic per kilogram of meat produced. So look at Denmark. Look at these countries up here. These are the good actors. They're now using, Denmark started the process in 1998, 99. 20 years later, they're using around 40 milligrams of antibiotic per kilogram of meat produced. By contrast, the US is using almost 4 times as much. Now, there are some other bad actors in Europe, Spain and Italy, for example. But, even just look at this right here. This is an average of 30 European countries. Some of them, like Italy and Spain, are really high, some are really low. But even the European average is at least 20 or 25% better than the US. We got a lot of room for improvement in the US. We know what to do, we're just not doing it. And when a country really does get serious about this, they can reduce their antibiotic use incredibly quickly. We know because the Netherlands, Denmark, now the United Kingdom have all told this story. This is just one of those examples, the Netherlands. So if you look here, they ended growth promotion in 2005, it looks like. So 12 years before the US. They didn't see any change. Gee, maybe because they continue to allow the same antibiotics for disease prevention, do you think? It was only when they banned routine disease prevention that they saw this huge decrease. And now, this number is a little outdated. Now the Netherlands overall has seen something like a 64% decrease in their antibiotic use just since 2009. They've gone from literally one of the not so good meat producers in Europe to one of the best in terms of their antibiotic use, and they've done it in less than 6 years. What? No, sorry. More like 10 years. But very quickly. And most of this has just been in the last 3 to 4 years. So first they set a target for overall reduction in antibiotics by 50%. They met that target early. Then they increased it by quite a bit, I think to 60%. And then most lately, they increased it to 70%. So their goal is to reduce, relative to 2009, their antibiotic use in meat production by 70%. Again, neither the USDA nor the FDA has set any target. We can do better. Just in terms of pigs, the US uses about 7 times more antibiotics per kilogram than either the Netherlands or Denmark. Again, we can do better. I hinted at, why the lack of leadership. And I'm going to pontificate here. Of course, you can't say definitively why Congress hasn't acted since 1977, but I will just point out that the meat industry and the pharmaceutical industry are 2 of the largest, most powerful industries in Washington. I think the stat that I remember is that the pharmaceutical industry alone has more lobbyists than there are members of Congress. And again, asking an industry to reduce sales of its own product, that's a tough sell. Like, asking nicely won't even do it. right? So money is definitely an issue, but so is like the complexity of this issue. People don't like complexity. People don't like to change behavior, you know? But I think we're going to be forced to really quickly. And then there's also an issue of geography. I'm from Minnesota. Many of you are from Long Island. I think we have more turkey and pig production than you do. So, you know, a lot of who sits on the Agriculture Committee in the Senate and who sits in the committees that oversee the USDA and the FDA are representatives of the same states where these industries are huge and really dominant. So regardless of what the rest of us think, it's going to be a very hard slog to turn Congress on this particular issue, even when 150,000 people might be dying a year. But what else can we do? We can change markets. We are changing markets. People like you and me are voting with their pocketbooks, and the retail food industry is on notice, and they are taking note. As I said, the chicken industry has completely changed about face. Now, by our reckoning, 14 of the top 25 retail chicken chains, you know, the KFCs, the McDonald's, the other Subway, they have chicken antibiotic policies now. That was not the case 4 years ago. So we started collaborating with groups on something called chain reaction, basically gave a grade to these top retail chains, and then we campaigned heavily along with you all to tell these companies that this mattered to us. And they listened, and they changed. And now Purdue and Tyson and a lot of the major chicken companies have rapidly followed suit. Why? These are some of their biggest customers. Again, by our estimate, over half the chicken industry now uses antibiotics, what we call more responsibly. It doesn't mean no antibiotics ever. It means that they don't permit routine antibiotic use. And now three top restaurant chains have now changed their policies so that they're reducing antibiotics for all meats. And just a little over a month ago, McDonald's came out with a really important and significant new policy for its global beef supply. And it said we're going to move towards no longer allowing routine antibiotic use. That's huge. We gave them appropriate kudos. So there are state and local policies. 2 states now, California and Maryland, have passed bills, have passed laws that try to get at this problem of routine antibiotic use. San Francisco, though, is the only city to do something that makes a lot of common sense when you think about it. It's asking the biggest supermarket chains, the biggest retailers, to ask their own suppliers, how much antibiotics are you using, say, in your beef or your chicken? We want you to tell us, and then we're going to collect all that information and put it up on a website and show the public, so that the public has better information about antibiotic use in the meat sold in San Francisco. Now, any city could do this, but San Francisco is kind of the first out the gate. And it's just starting to be implemented, so we don't know yet what the impact's going to be, but certainly it's one of the biggest cities and one of the biggest in the biggest state. So it'll have some impact for sure. Here's that chain reaction report I talked about. There's other ways you can raise your voice. I think there's everything that we can do individually, but I think adding your voice collectively to other voices is really going to be where we're going to see some big changes. So we're part of an effort called Antibiotics Off the Menu, along with some other environmental groups. consumer groups, Consumers Union, which is in Yonkers, Center for Food Safety, Friends of the Earth, and the PIRGs. And so together with you, we're going to have a campaign to hold these biggest food companies accountable. And I'll let you read the rest of it, but if you go to the website, you can find out some more there. And then I started this effort for health professionals. Any health professionals here? Good. So I think personally that one of the issues is that health professionals see the problems with patients getting resistant infections, but we are not accustomed, nor have we taken the time to go back and say to the food service in our hospitals or in our kids' schools, where are you getting your meat from? Are they serving antibiotics? You know, what's the impact of that? So Healthy Food Action is a network now of about 11,000 health professionals and others, and we try to elevate that health professional voice, because if we're talking about health and the environment, who better to talk about that than nurses and dietitians and psychologists and even physicians? And then, you know, I think a lot of us are still learning how to use social media more effectively. It can be a really great tool for amplifying your own voice to other voices. So my handle on Twitter is Food Doctor. And, you know, I welcome all of you to find out more about what I'm doing there. And then finally, I want to add on something that I know is going to resonate with other speakers and with lots of folks in the room. And that is that one thing we could do is just eat less meat. Not just because of antibiotics, because, you know, some of that meat's going to be organic, raised without any antibiotics. So, you know, isn't it still, though, good to eat less meat? Nutritionally, in terms of the carbon impact, the greenhouse gas emissions? Absolutely. You just heard from the previous speaker about the last piece. So I think it's a win-win-win. If more of us ate one less meal a week, we'd not only be reducing the greenhouse gas impact, we'd not only be improving our nutrition, but we'd also be helping save antibiotics. So thank you, and I'm happy to take some questions. Yep. Oh, wait for the mic. I'm between you and lunch, which is always a dangerous place to be, right? Oh, okay. There's a handheld underneath right there.
Oh, okay.
Yeah. That's okay. Got my own.
Two questions. First off, should we be eating free-range meat because they don't use antibiotics? Or is that not something that we, you know, is necessary? And then the second thing is, you're saying, you know, it's not good to have antibiotics, but what about hormones? Because I try to eat meat with no hormones as well, being a female who's had cancer.
Right, right. Everybody hear the question? So the hormone piece, claims on retail meat labels about hormones have not been, are not well enforced. So you'll see a lot of hormone claims on chicken. Hormones were never allowed in chicken, right? So it's a non-issue there, and it just kind of confuses people. They are, though, used really routinely in beef production. And I think that for some of the same reasons I highlighted on antibiotics, there's been almost no research funded to look at potential impacts of hormones in meat production. Now, does it make common sense to avoid exposure to hormones in meat? Absolutely. Do we know the levels in the meat? No, because, you know, that's not something that's well monitored for or reflected on labels. So, you know, I think your intuition's probably right, but you're not going to find a lot of science other than common sense science to kind of back it up. Do you need hormones to produce meat? No. Just like antibiotics, it was a practice put in place to make animals grow faster, to put on weight faster, to make more money more quickly. So if there are health impacts from that, it's a case of profit over public health, which I think is kind of a recurring theme, right? So your other question, remind me? Oh yeah, I went back to this slide here because, you know, there's a little bit of a disconnect between what you see on the label at the store and what you ought to be looking for, right? So a lot of people want the easy thing. And so certified organic becomes the easy thing unless you can't afford certified organic, right? And organic meat can be quite expensive. I buy, to the extent that I still eat meat, I try to buy directly from the producer and I ask them. So, you know, I say, what's your farm look like? Are you using antibiotics? How much space does the animal have to roam in? You know, and at least then I feel somewhat better, like I have more of my finger on what's actually going on, and I can usually get a sense of whether I think they're being straight with me. I think mostly the farmers are. So, you know, I don't feel like I have to buy certified organic, but I definitely try to buy raised without antibiotics or without routine antibiotics. I don't eat a lot of beef, and that's the one where I think it's going to be hardest for the US beef industry to transition away from routine antibiotic use for a lot of reasons. Mostly because they're bigger, longer living animals, so there's more opportunities for them to get sick at some point. Now that being said, I've talked to plenty of ranchers who raise their cows on pasture, and they say, we don't need antibiotics. Our animals just don't get sick. And I've heard the same from pork producers who raise pigs on pasture or in hoop houses. Do you know what hoop houses are? They're these pretty inexpensive structures that they provide enough shelter so that the sows can farrow their young in one place and then they just stay on pasture. So out in the plains where it gets pretty cold, and you know, keep in mind at home it's going to be 36 degrees below zero tomorrow. Yeah, the schools are all shut down. The animals get cold. They need something to shelter them. And the little piglets in particular are really vulnerable to get sick when the weather extremes. But there are other ways to design resilience in that animal apart from relying on antibiotics. You know, you can build hoop houses, you can improve their nutrition, stuff like that. Thanks. In the back? Yeah. Next question.
Yes, actually I have to say something to her question. If you really have a disease or can't afford the nice organic meat, I can tell you about that, about something about that too later on. You should just eliminate meat altogether, then there is no antibiotics. If you have a whole food plant-based diet, it solves the problems. You save money and everything. And the small-scale organic farms, I come from a farm, and the mark check in Canada, they went to the farmers market from all these lovely people. They were all cheating. They were all selling stuff from another source. You can't oversee it. And even the people that I've been to many farms in South Africa, in Australia, in Papua New Guinea, not in America lately, but in Europe. I'm German, I live in England. 80%, you know, you see a few chickens running around, and in the back, they're locked up. You can't oversee that. And even a lovely farmer that you go to who loves his chickens and animals so much that he slaughters them and eats them, he would also do the same. I mean, when people are cruel enough to sacrifice an animal's life for their taste, they will also, you know, lie to you. Yeah, I've seen it happen. It's my mom's friend. She's 85 now. She has her own backyard chicken, sells them on the farmer's market, and then she sells salad from the guy that supplies the big supermarkets, and they all think it's, you know, grown in her backyard. Sad. I hear it everywhere. I can name 100 people that do that. So we're all wanting to be lied to. We all want to hear something good about our bad habits. And by the way, we only have antibiotics because they, by chance, in animal tests, people always talk here about studies in mice. They're all flawed. Animal tests don't help us. They actually hurt humans. We only have antibiotics because actually Alexander Fleming discarded it when he discovered it, because it was dissected by the rabbits that he tested it on, and he had a patient that was dying, and he said, just give it to me. His partner somewhere else in 1929 tested it, I think, on his cat, and the cat died, the antibiotics.
Did you want to ask a question?
Sorry, that's it. I'm finished now. Bon appetit, if somebody else wants a question.
Oh, I think Steve's saying we have to wrap up and get to the lunch, I think, but feel free to grab me and ask the question after the fact.